Is there anybody else whose apologies I'm missing, Caroline? Oh, Scott is away on holiday as well.
Yes, Scott Haldane's away on leave. Rachel Gomm's in the car. She'll join us when she's home. She's stuck in traffic. And Steve Cox is unable to join us as well. It's his daughter's birthday.
Okay, fabulous. Thank you so much. We should note and offer our congratulations to Scott and his wife, who are celebrating their Ruby wedding anniversary this week. That's why he's away. So that's an important event to note. Let me invite us to go to the minutes of the last meeting. I am surrounded by bits of paper, so bear with me. Bits of paper and a cat who's taken up residence next to my keyboard. So if I get disconnected, it's the cat's fault, not mine. So can we just go to the minutes, and can I say, has anybody got any issues they'd like to raise on these in terms of accuracy? In which case we'll say thank you very much for those. We have some actions that are in some cases persistently and rather stubbornly open. Caroline, do you just want to walk us through these and signpost? We've got one on the FOI report where I think Holly was going to pick up a conversation. Is that right?
Apologies, Arlene, I was distracted.
Right. Holly, the FOI item is to reintroduce the number and types of exemptions being used, a report on that. So it's an extension to the existing report. Could you just have a look at that?
Yes, I will do. And I know that has been being discussed within the team. And it might be worth mentioning that actually we are going to introduce a performance and risk executive meeting for corporate services. And so this is one of the things that would be discussed in that forum and then go through to Business and Performance Committee.
All right. Can we move it along? I think that's my emphasis for this evening. So there is, again, Holly, this sits with you around a more detailed report into quality and safety about ADHD and autism spectrum. You've provided some update there. Is there any more we need to do on that?
I don't think so, unless anyone has any questions.
No, I mean, do you just want to, I mean, that is, these are lists that are being heavily monitored and managed, we should say.
Absolutely. And in terms of both, so obviously we've got two services, one in children and young people and one in adults. In terms of the adult position, we're currently working with the ICB to look at supplementing service delivery so that we can improve that pathway and reduce that waiting list, both in terms of numbers and size. And for children and young people, there is a piece of work looking at the whole of the sort of neurodivergent pathway, so that we're trying to approach it from a pathway perspective rather than just an individual diagnosis perspective.
Yeah. Apropos, nothing desperately happy in this, but in terms of our children and young people waiting lists in this area, they're about 51, 52 weeks, I think, Holly. They still stand at that level,
yes.
Don't they? That's terrible. That is awful. However, contextually, there are an awful lot of places across the country that have 2-year waits for children and young people. So whilst we think a year is awful, and it is, I'm just putting us within the context of some parts of the country where it is a 2-year wait, which if you're a parent is just awful. So we've got a frequent flyer here on the DBS matter, which we've discussed previously. Stephen, I'm going to ask you to update on this.
Thanks very much, Eileen. So we've obviously, as we reported last time, we've signed off the new DBS policy. We've now done a review of the exec. That's been done. We've now done a review of the NEDs. They're all now done. So we're about to go out to the governors. So we produced a letter that will go out to governors. That's going to be sent across to Zara, and then she can then engage with governors. We can't do the formal DBS for governors. They have to do it themselves. But obviously, we're not expecting governors to use their own sort of money to fund this. And so they will need to fund it up front. I hasten to add, apologies. And then basically we will recompense them, and then they will hold a simple DBS check. We will hold a central list. We cannot hold the DBS itself. It's all around GDPR. So basically each governor will hold their own DBS, simple DBS, and we will just have confirmation that basically you've had that simple DBS.
Right. So what we need is some simple instructions out quickly from your team, please. Yep. And let's get this moving. Anthony, do you want to come in?
Yes, I'm vice chair for a charity. I'm able to get a DBS check done through there and an enhanced one that would cover more than one organisation. If the CPFT are willing to contribute to the cost of that, I would be delighted.
Yeah, I think let's just keep it specific to CPFT, and let's keep it that simple DBS check. And as Eileen's just said, it'll be a really quick, easy process for people to follow, and the DBS simple checks come back really quickly.
Yeah, if we can just keep this CPFT, it's a good suggestion, Anthony, but there are occasionally issues when people try to use the DBS for more than one organisation. It can get you into a bit of a pickle. So the matter on occupational therapist vacancies, the data is supplied in the action log for everybody. So hopefully that makes a degree of sense to all. If I go to my report, before I jump into any detail, I'm going to pass over to Andrea, who's looking very summary, to just say a few words. Sybil, did you want to come in on something before I pass to Andrea?
Yeah, it's about the DBS and the CPFT protection. When I was employed, so the CPFT did my
we can't hear you very well, unfortunately, Sybil. Are you able to type your question in at all? Because we're getting really, unless somebody's got infinitely better hearing than me, it's not coming through desperately well.
Okay, can you hear me now? Is it clear?
Not very, I'm afraid, no.
Okay, you can continue.
Yeah, we can't hear you. If you're able to find a way of typing the question in, I promise you we'll endeavour to answer. I will go back to inviting Andrea in, if that's okay, before I start my CEO's report.
Good evening, everybody. Thank you, Eileen. Can everybody hear me? Yeah, okay, great. I'd just like a few moments to pay tribute to Keith, because this is going to be Keith's last COG meeting. And after 9 years of exceptional service, I don't think we can allow that to pass us by without some bit of a mention. So if you'll indulge me, I'd just like to say that I have found Keith to be diligent, dutiful, I might even say heroic as a governor. He's always been there. 9 years of outstanding service, not only as a carer governor, but also as our lead governor during the very, very difficult times of COVID. I can't imagine how that was, Keith. But I think you've been a model governor, dedicating your time to helping others in the community, as well as helping the trust to improve its governance. And I have a feeling I only know a fraction of your work with carers and with adults with eating disorders, but I do know that the work is very well received in the community and well known. And in fact, when I first joined CPFT as a governor, I was speaking to another yoga teacher about it. And the first thing they said to me was, "Oh, you must know Keith Grimwade then, because you had touched that person's life in a way that was very substantial to that young adult." And I know that there will be many other hundreds of people's lives who you've touched, Keith. So I'm proud to say, yes, I do know Keith Grimwade, and it's been an honour and a privilege to serve with you and to learn from you. You've made my stepping into the role of lead governor so much easier. You could have been very difficult, but instead you've been like the oracle that I can consult without worry about anything. Whenever I've needed to know something about the history of the trust, something that you'll have covered in your time, you know it right there and then without having to check anything. You must have a photographic memory. And I've also just found you to be an incredibly kind, measured and balanced person. And we've had to do some very difficult things over the last year, and your support in doing that and the way in which you've been very measured in some of the difficult decisions, I think is exemplary. So you'll be acutely missed, Keith. What shall I do without the oracle? So I'm sure that you're not standing down because you want to, but only because you've run out of time. And I think that probably is just a reflection on how you are as a governor. And I hope we will see much more of you as a volunteer. So I hope everybody will join me in saying thanks very much to Keith. We've had a bit of a collection and we've signed an electronic card for you. So you'll be able to see a wider range of thoughts than just my own. Thank you, Eileen.
No, thank you, Andrea. And Keith, you know, I hope just how much I have valued your support. You've supported everybody here in different ways, and it would take all evening to talk about little memories we have of you, but I will always remember your ability to make us smile, even in the darkest of times, and that's a rare gift. So thank you from me. And as Andrea says, a little gift should be winging its way to you tomorrow. But you're not gone. You're not leaving us completely. And we know that, and we'll treasure and enjoy all that you do for us. But Keith, we ought to give you the floor to say whatever you want to say by way of valedictory.
Oh, thank you, Andrea. Thank you, Eileen. That's so kind. Oh, yes. I see that it's been my privilege to represent carers on the Council of Governors for the last 9+ years. I mean, some things have changed. Pity Scott isn't here, or I'd rib him about Scotland making it to a major football competition finally. But I insist that that's minuted. But I mean, seriously, things have improved. Things have gone in the right direction, although undeniably there is still a lot more to do. I mean, I've worked with some wonderful governors, staff and volunteers, and I will be continuing as a volunteer for CPFT, running the Adult Eating Disorders Carer Support Group and chairing the Carers Programme Board. So I'm sure I will meet many of you again, albeit with a different hat on. When my dear friend Liz Mitchell, who died far too young, stepped down as lead governor due to ill health, what she left me and us with was the fact that there are always 3 more things to do. And I've kept that very much at the front of my mind. I wish you all the best. And what I'd like to leave you with is just 2 words: keep going.
Thank you, Keith. And you've made us all smile, which is, as I said, one of your great gifts. We will keep going. And if there were only 3 more things to do, I think we'd all go, brilliant. But perhaps a few more than that. But thank you. We are going to miss you hugely. And thank you, Andrea, for your lovely words. I'm just going to say, please take my report as read. I'm going to pick up on one thing, a specific, and also say that in terms of CEO recruitment, we're going to return to have a discussion together about the process that we're working through, and to take views from you as to some of the characteristics you'd like to see in an incoming CEO. So we'll come to that later. But there was a question that Andrea shared with me, which is about some of the things I've been saying of late about how we're not properly funded. And I make no apology for that, because if I didn't believe that we weren't properly funded, I wouldn't be saying it. But it's important to have evidence. It's not sufficient to say I know or I feel, but, you know, is there evidence? So just on the query around inpatient beds. So per capita, Cambridgeshire and Peterborough has the lowest number of beds in the east of England. And just by way of comparison, we've got, if everything was fully open, we have 194 beds for a population of 1 million people. So that means we have one bed for every 5,155 people who live within our borders. And bearing in mind, we've got a growing population and are slotted for growth over the next 2 decades. So that's one bed for every 5,155. If you look to Hertfordshire, same sort of trust as us, they have one bed for every 3,550 of their population. So they've got 338 beds in total, but it's one bed for 3,500 people, essentially. For Norfolk and Suffolk, they've got 408 beds, and they've got one bed per 3,900 people. So you will see from those numbers alone, not that inpatient beds are everything we do, or not that inpatient beds are the answer to everything, that we have an issue here around, for the most acutely ill people, we don't actually have enough beds to put them into. And that means that we're sending people out of area, which at times feels like an immoral act, because they're very poorly quite often. It's difficult to keep consistency of clinical oversight. And then, frankly, it costs us a fortune to do that. So inpatient beds are one part of the story. There are parts of the country that have not quite as low per capita as us, but, you know, getting towards it. But what they have is they've had investment in their community-based mental health services, and we haven't had that either. So what we are is squeezed in both inpatient and community health. So there is much to do, there is much to advocate for, but I think it's really important for all of us, whatever lens we see this through, to be taking all and every opportunity to say that the people of Cambridgeshire and Peterborough are not being properly funded in these areas. And community physical health, which we should not forget is such a big part of what we do as well, is also underfunded. And those have been decisions taken by people who are lovely people over decades to not prioritise these services. And we've kind of got to start challenging them as to why not, and reminding them that there is a duty to all aspects of the population that we serve. So I hope that gives you the detail around why I draw out the evidence that we have for where we are today. So I will stop at that, if that's okay. Can I invite Caroline to just give a brief update? And election processes, as we all know, we're in the midst of a general election, are things that have to be treated with great respect around process. But Caroline, are you able to just update as to where we are on the election process?
Of course, Eileen, thank you very much. I'll just flick to my notes, bear with me. So in terms of this year's governor election process, we've had really good interest and a high number of nominations. The nomination process opened on the 27th of March and closed on the 24th of April, during which time we received 16 nominations, which is absolutely fantastic. In terms of our constituencies in line with our constitution, we have 9 seats within the Public Governor Cambridge constituency, of which 5 are vacant, and we've received 5 nominations, which means this constituency result is unopposed. We have 5 seats within the Public Governor Peterborough constituency, of which 3 are vacant. Again, we've received 3 nominations, which concludes an unopposed result. We have 2 seats within the Patient Governor Cambridge constituency, of which we have 1 vacancy, and we've received 1 nomination, again, unopposed result. We have 1 seat within the Patient Rest of England constituency with 1 vacancy, and again, we've received 1 nomination, which concludes an unopposed result. Excuse me. And we have 4 seats within the Staff Governor constituency with 4 vacancies to fill. And for this constituency, we've received 6 nominations, which means this result will be opposed and we therefore move to a vote. And sadly, we didn't receive any nominations for the Carer Governor constituency, which leaves us with 2 vacancies. Voting is now open for that opposed Staff Governor constituency, and that closes next Tuesday, the 25th of June, and the declarations of results will be published next Wednesday, the 26th of June, and I will then contact the new unopposed governors as Trust Secretary, and all unopposed nominations will continue in their governor role, and we'll look forward to welcoming some new unopposed incoming governors with a planned induction date at the end of July, which we're just working through now.
Bless you, Caroline.
Is that helpful?
Yeah, Keith, you've been working to help us get some carer observers, I think. Is that right?
Yes, that is. So Anna Tuke is leading on that process, working through CPFT and with our partners to recruit 2 carer observer governors. And she aims to have that completed by mid-July and therefore in time for induction.
Brilliant. Thank you. And Caroline, you are currently working on revised induction materials and then a programme of induction for our new governors.
I am, yes. So there'll be an induction pack and we have a tight induction programme to welcome all of our new governors in, of course, with yourself, Eileen, as the Trust Chair and Andrea as lead governor, the Senior Independent Director, etc., etc. So the whole process will be revised and refreshed.
Okay, brilliant. Thank you. Could I then move then to Stephen, who's covering for Scott? And I should say that Stephen is being, we've used the word heroic once this evening. Stephen has COVID at the moment and is not feeling at all well. So it is quite heroic of him to turn out. And I'm grateful to you for doing that, Stephen. So over to you.
Thank you very much. Thank you, Eileen. And I'm feeling slightly better than what I did on Tuesday, if I'm honest. So look, I'm going to take Scott's paper as read, but I just want to draw a couple of things out. And I also want to go slightly off piece, should I say, first of all, because yesterday was the National Healthcare and Estates Facilities Day. And I think it's just really, really important for us to recognise as a Council of Governors to those people who sort of work behind the scenes. And unfortunately, I was actually due to present an award, a long service award, actually, to a member of staff who spent over 40 years in behind the scenes post working at Fulbourn Hospital. So I just think it's really important for us to recognise that. And then just going back to Scott's paper, I just want to draw out a couple of things, basically. First of all, the Cambridge Children's Hospital. I think it's really important for us to obviously be aware of this piece of work, recognising that, you know, they've received confirmation that the full outline business case was approved, which basically means they can now proceed to that full business case stage. I think we also recognise there's a lot of work for us to do, but it's really important that sort of integrated approach across the system and working in partnership with our colleagues at CUH, the university, etc. So I think that's important to note. The next part I want to draw out then is just around the financial or the planning update, the operational planning update. And I'm also cognizant that there has been a bit of a question around some of that around the workforce position. And there is a statement in the paper around the flatlining, for example, of the workforce during 24-25. And I just thought I'd spend just a few minutes clarifying that point. Basically, what we're saying in our plan for 24-25 as an organisation is that we will continue to grow our staff base. So that's our full-time, that's our permanent staff during that period. But at the same time, actually, we're going to be reducing our bank and agency use. So as we continue to recruit to some of those really hard areas to recruit to, that's inpatient wards, that's health visiting, etc. And we've discussed that previously here. We will look to reduce our bank and agency usage. So overall, that's why you get that flat line over the year. So it's not saying that we're not recruiting to posts at all. We will continue to recruit. As I say, we're actually actively recruiting at the moment for our Mulberries wards, our health visiting, psychology, many posts across the organisation, and that will continue during 24-25. So I just wanted to give that assurance today. I think just picking up on sort of Eileen's point though, we also recognise that actually as an organisation, we do need further investment in certain parts of our services. So we are doing something what we're calling a service review, and we are working with colleagues across the system to do that, because we recognise there are elements of CPFT where we do need to be pushing the agenda around additional funding. Now that may be funding through the ICB, that may be regional funding, that may be even national funding for some specialist services. So we've clearly got a lot of work to do there, and we really do need to be pushing that agenda forwards. I'm going to stop there and then take any other questions that colleagues may have. Anthony,
Eileen, you're on mute.
Sorry, Chair, I'm trying to look at pieces of paper and a screen. I'm clearly just not with it this evening. Stephen, there was a question about giving assurance about the actions we took to get ourselves to break even, which did include a sum of about 5 million that came from system partners. How we're going to maintain balanced run rate as we go out of this financial year and into the next financial year. Hard question to answer, and I think you've addressed a little of it in terms of what you've outlined previously, but I think perhaps we could just give that a moment.
Yeah, exactly. So let us just quickly go back to 23-24, where the organisation found that it got a significant deficit. Obviously, we put ourselves into sort of, quite a challenging position, driven by, a number of issues. Some of those were, for example, out of area spend. Some of it was around use of medical agency. Some of it was where actually we'd invested in some of those back office type services. And really that drove quite a significant deficit. Eileen's already mentioned in 23-24, we got some system support of just over £5 million. And at the same time, we as an organisation put in place some grip and control measures from September last year. That brought us into a very small deficit position, a break-even position actually for 23-24. But I'm also very cognizant that our accounts are currently just being audited as we speak. 24-25. We yesterday at BNP looked at our 24-25 plan. That is showing a break-even position, but that break-even position basically is based on a very challenging efficiency plan of just over £18 million for the organisation. It's also based on us receiving some further support from the system of just over £2 million.
Yeah.
So basically, I think it's fair to say that, one, we've got services who are quite challenged at the moment. So while we're delivering an efficiency plan and while we're getting some support from the system, we continue, as I said before, to actually do some of that service line reviews of particular areas. And we intend to do the whole of the organisation in order to actually look at, are we getting paid the right amount of money for delivery of service? At the same time, we are looking at some of our corporate back office type functions, and I think it's fair to say there needs to be further work done there. And then finally, I think the organisation needs to look a bit around some of its structure and how does it deliver services in 2024, and begin to look at how we want to deliver services over the next 2, 5 and even 10 years. And I think that's a really important piece of work that we need to do.
Indeed it is. We need to be co-creating the future, basically. Anthony, can I bring you in briefly?
Yes, sorry, in the middle of eating. There was a discussion that was going to be had in regards to the possibility of using our property portfolio in some way. I think it was to do with one of our sites. I can't remember, it's a business informant yesterday. To actually support staff with housing. Is that going to be part of a future plan, or is that just an idea at this stage?
I think Anthony would, yeah. Stephen, we have to be very careful about details around specifics, but of course we need to think about housing, don't we?
We do need to think about housing, but Anthony, I think that's a conversation perhaps to have offline. The only thing I would say is, as a system, we are looking at housing, and we've come together, and as a number of organisations in South, so ourselves, CUH, Papworth, we have been having conversations as well around housing and just the cost of housing. But for me to be able to influence and shape, we strategically need to work as a whole system to do that piece of work.
Thank you.
Okay, fabulous. Andrea, could I move on to you if that's okay? You can get yourself off mute. While Andrea's getting herself off mute, I'm not sure if Rick is with us tonight to thank him for his membership working group update report. But just to say that Chris, who's the Director of Comms, has gone back to Rick to clarify with him all the work that has been done, and Nora's written about some of that already in terms of trying to get staff more engaged, but also some of the support that has been provided. But he's going to have a discussion with Rick again after he comes back from leave, just about more proactively what he can do. There was a question about the weekly notes, which myself and Scott have been sending out, and you'll get another one tomorrow, hopefully. I think I would ask you to treat the content of that. We tried to write them in I tried to write in quite an open style. I would invite you to treat that as something you get confidentially. If there's something you particularly wonder whether you could talk about it somewhere else, I think it'd be good if you could just reach out to me. I think that'd be the better form of valor in this. What I don't want to do is feel constrained by saying you can talk about this, you can't talk about that. Rather that you would reach out to me to say, if it's myself or Scott, could we refer to this somewhere else? Andrea, any luck?
Yes, I think so.
There you go.
Sorry, not dexterous enough on my trackpad. We had said special thanks to Keith, but I'd just like to note in my report that there are a number of governors who are leaving us due to the elections, and I'd like to say thanks to them all on behalf of us as a governing body, because everybody who's a governor does so voluntarily and gives lots of time and effort that we don't see in the formal meetings. So I'd just like to formally have that minuted, please.
Thank you, Andrea. Really helpful. We still got you with us? Yes. Yes. Anything else at all for Andrea? No? All right. I'm going to propose that we work our way through the subcommittee reports, and then we'll pause to see if there are any outstanding questions. The Audit Committee summary report. Brian, unfortunately, not being able to be with us this evening, but Stephen valiantly saying he'd attempt to field any questions that came out of that. So any questions at all on the Audit Committee? And obviously we are just closing off the year-end accounts, so it's sort of limited amount that we can say about that whilst that's going on. The Quality and Safety Committee, Karen unfortunately had a prior commitment this evening, but Mike, who sits on the committee with her, is here and available. Mike, do you just want to give a few headlines? and then I've got a couple of questions, but if we could be as brisk as possible because we have a lot to get through tonight.
Yes, thank you. Well, firstly, hello everyone. For those who haven't met me, this is my first Council of Governors meeting. It's very nice to see you all, and I hope I get a chance to meet you all face to face at some point. To be honest, Eileen, these two reports are for March and April quality committees, which of course I wasn't at, but I was at the June and May committee meetings. And so what would I say as there are three areas I think that we're thinking about. One is the actual data on quality and safety, and we look at that with some rigor. The second is the quality and assurance of the data that we're receiving. So we're looking at policies, we're looking at risk and how we manage those and how we can manage those in a better way so that the data on which we're making judgments around assurance is improved. And then there are some specific items which bubble up. You will no doubt have some detailed questions, but
Rachel is here to assist as well, Mike, and I do apologise. I'd forgotten this was your first meeting, as I said in the chat. It feels like you've been here forever.
No. So but those, in terms of how we're approaching this, the third area will be, I guess it's worth mentioning that I was able to attend the improvement board, which is the ICB oversight of some of the quality and safety improvements that we're engaging in following the rapid quality review meeting in April. So those are the sort of top level stuff, but I guess there may be more detailed questions which I'll try and answer, but if I can't, I'm going to, Rachel and others will no doubt help me out.
And you've just given me a really helpful nudge, Mike, by referring to this improvement board, which is, I want to say jointly chaired by Rachel and, but not anymore, by someone from the ICB. It was going to be jointly chaired. That having been created, Rachel can mention it. It does mean that we are moving out of this process called double lock. You'll recall we've talked a lot about the level of oversight. I've talked a lot about the level of oversight being deployed by the ICB and what a distraction it is from improvement. That has now been lifted. But doesn't mean that we don't have a duty to report on improvement, and there is a formally constituted improvement board which Rachel sits on, and she can perhaps mention that. But before we go to you, Rachel, there was a very specific question which Holly, I think, answered yesterday, and it's not something in the papers, but it's about the Young People's Forensic Service. Holly, do you just want to talk about that? We've had a serious issue with consultant being away, I think. Do you just want to rerun that answer?
Yeah, so those who aren't aware, we run a forensic children and adolescent mental health service. This is a nationally commissioned service and is one of a few very specialist services where our clinicians support children and young people who are involved in forensic services. That service has been seeing an increase in referrals, but has also been struggling in terms of staffing. So our consultant for that service is currently absent and leaving. And within the sort of multidisciplinary team, we should have 8 whole-time equivalents, but at the moment we have 3. We are actively trying to recruit. So following discussions with the national team, we made a decision to pause for referrals to this service for a period of 8 weeks initially, so that we could do some risk stratification in terms of the number of children and young people currently on that caseload. I think it's important to note that actually these are quite unique, very niche and specialist services. So actually the clinical team aren't directly delivering sort of patient care or seeing the children or young people. They are very much supporting a sort of multi-professional team So they'll be joining sort of multi-disciplinary team meetings, providing advice and guidance on how to support and manage these children and young people, understanding sort of what risks might be involved with these children, and again supporting social workers, probation workers, police and the judicial service with sort of strategies to try and support children and young people. So we've still been providing that service with the 3 individuals that we have. Referrals are still being accepted nationally, and actually the national team have been supporting us in redirecting those referrals to other forensic children and young people services. Whilst we do this risk stratification work, and actually that work is ongoing. We've managed to discharge 32 children and young people from that service, and that is continuing. We do have a locum consultant who will be coming to join the team, and we've also used this opportunity whilst we've paused to referrals to review the service, benchmark with others providing this service, look at what the current sort of national best practice is, and make some service changes so that we can hopefully have a sustainable service going forward.
Thank you so much, Holly. I'm going to go back to Rachel, because Rachel, there's a question about the CQC and how things are feeling about that. And it's possibly for another meeting, we'll take a more substantial item on reporting back on CQC visits and themes, but just a moment on CQC, really.
Would you like me just to cover off the improvement board as well?
Yes, if you could do that in tandem, that'd be lovely, Rachel.
Yeah, if I do the improvement board first. So as everybody's aware, and Mike's referred to, we did have the rapid quality review meeting early in April. For those of us who've been around a long time, they previously called a quality summit, and basically the purpose of that is it's an escalation meeting through NHS England process that there were concerns raised in some areas, so the ICB called this meeting. Following that, we now have what's called an improvement board, and Eileen's absolutely right. Initially, in the terms of reference, it was suggested that Carol Anderson, who's the chief nurse in the ICB, is the chair of that board, and as I said, in the terms of reference, suggested that I should co-chair that. I did challenge that right at the beginning because I think it's, again, in terms of due process, we're being held accountable at that meeting, and if I'm co-chairing, it's a bit of an odd situation to be holding yourself to account in that forum. That's been fully taken on board. There was the first meeting, which I wasn't actually there. I was actually away for a few days, but colleagues were there. Other executive colleagues were there. That's also attended obviously by wider ICB colleagues and colleagues from NHS England and CQC. I think it'd be Mike attended as our non-exec representative. I think it'd be fair to say it was challenging in parts, and possibly as expected for the first meeting. It's going to be an iterative process, and in actual fact, Holly, myself and Kathy have met with our counterparts in the ICB today, really to talk through how we can get this working better. And I'm hoping Holly will probably nod accordingly. It was a really productive meeting. We talked about what the rub is as such between what we bring up, what they bring up, and how they're holding us to account, and also equally how we're looking to support from them and from the system. And they, I think quite rightly so, suggested that we do go and look at other improvement boards that have been taking place within our system, specifically with both maternity units for NWAFT and CUH. And I think that's a really good suggestion. And when in our discussion, what was described was that where we were at with the first improvement board, they've been reflecting on it, and that's where they were with those improvement boards, and in time they've moved on and are now functioning much better. So I think we do need to keep really good communications with them, and be prepared that there will be challenging discussions, and that's quite right. We should be being held to account. The next issue with the improvement board is how we then have our governance structures within the trust feeding into that, and how it flows up and down. So it's a bit of a changing process at the moment, but we're learning from it, and I'm very hopeful that it will work better. I don't know whether, Mike, you had some good reflections. I don't know whether you wanted to share, because you were there. You might have.
Yes. So I was pleased to be there. It was well attended. There were 22 people around the table, good representation from the ICB and ourselves and partners, including the 2 county councils. So from a multi-agency point of view, there was ways and means. And I think it served 2 purposes. One, it was, I thought, very constructive. Of course, it was the first meeting. So he spent ages talking about the terms of reference and how they were going to work, rather than actually holding us to account, really. So it was the first meeting, and they're going to be every 6 weeks. So I think it's going to be very helpful in terms of us dealing with some internal CPFT quality issues, and also some issues which are more multi-agency issues that need to be dealt with. So I was rather encouraged by it. And whilst there is the odd rub, you can only get cross with friends and sort it out. So I felt very encouraged by the meeting, and people were being honest and saying what they thought. So I'm hopeful that the next meeting in July will be a step forward. And as you say, it'll be an iterative, it'll be an iterative process over some months, I would imagine.
Yeah, I think.
But very helpful for us going forward as an organisation.
Thank you, Mike. I don't know if anyone's got any questions in terms of the improvement board. Stephen.
Sorry, Rachel, it's not a question, it's more of a comment. It's just to say that obviously, as Eileen pointed out earlier on, that sort of the financial rigour and the financial process, though it's been stepped down from an ICB perspective around what we called our finance recovery group, and we had an internal one and an external one, just to say that level of financial sort of rigour and overview will then take place through the improvement board. So though it has actually been sort of that formal double lock has been slightly sort of, stepped down, we will still make sure that, and they will still hold us to account through the improvement board. I mean, I think the other thing to say is it's a multi-agency, isn't it? So you've got local authority, you've got CQC, you obviously got CPFT, the ICB. It's a really broad range of organisations in a room with a very, very clear sort of purpose.
Yeah, thank you. Shall I move on to CQC?
Yes, if you could do, Rachel. And I'm mindful we've got our young people's forum coming to us.
Sorry,
I don't want to keep them late. No, it's fine.
I'll be as succinct as I possibly can. So we've had 2 recent CQC inspections. The first one in our inpatient adult mental health unit in the Cavell, and the second one in our community teams, which was just last week. This is under the new single assessment framework. In terms of where we're at in process, we had high level feedback for the inpatients, and then and we've then subsequently had their report that was checked for factual accuracy. I always struggle to get my tongue around those words, and that has been submitted, and in actual fact it was pretty accurate, which is great. And yes, there was some immediate learning, but I think overall there was nothing that we didn't already know about that we aren't already working on. So and then in terms of the community team last week, we have literally the day before had the high level feedback, and there's again, the team's already working on what they need to do immediately. There were some really positive points in terms of how caring the teams were, the good multidisciplinary working. They focused a lot on well-led. There were some estates issues that are all being sorted out as we speak, and there was also some issues in care planning, which we know is across the board, and that does need some dedicated work. But they are now doing the validation, or we're now putting in all the off-site material, all our evidence, and that will be being validated before we get the draft report, which will then need again factual accuracy checking. So I think, as Eileen's described, it would be very appropriate to do a presentation either at the next COG or the one after that to go into more detail in terms of the plans. But overall, I think it was, and what I'd also say is the clinical directorate's very much engaged, really, and very enthused by it. And also, in terms of the community teams for last week, we had literally 2 days notice. That's how it works now. And everybody, again, very well engaged, prepared as far as is possible. And yeah, and we've had our first CQC oversight meeting following those inspections this morning, and once again, a good outcomes, people really welcoming it, and we are learning about the single assessment framework as we go through, and we've got our compliance team have an enormous knowledge base on it, which is great, so they're supporting us very well.
Thanks, Rachel. I mean, a question that was asked, which was directed at NEDs, but actually I think it's appropriately directed at the whole board, is the quality of care getting better for a greater percentage of our patients? And I think my observation is that we're still working on consistency, but what CQC are telling us, they see no lack of care, but sometimes our systems and processes are not where we would want them to be. But Rachel, your thoughts?
Yeah, I think I'd agree with that, Eileen. I think certainly what came out of the community, and what we've, as you said earlier when you were talking about the bed base, that it's not all about inpatient, it's also about our community services, and equally, you know, the within adult and specialist mental health, but also let's remember our community physical health services. And I think if we were being very honest, that sometimes we focus a bit too much on inpatient and not enough on community. But certainly what was coming out of the initial feedback was that the care and for patients, you know, CQC was saying very caring, very compassionate, and good quality MDT. So yeah, I agree with you, Eileen. I think there are areas that we need to focus on without a doubt, but there's also really good care happening.
All right. In the interest of time, there were a couple more questions, so if you and Holly could just look at them.
Sure.
Chandra's asked a question about services for both adult and children's service. I don't think children's were inspected this time round, were they, Rachel?
No, the services that have been inspected were, as I say, the inpatient services at the Cavell, the adult wards, and there were 3 community locality teams, adult locality teams, and the Cameo South team.
Yeah, they'll get to children's in time, I promise you, and we'll have lots of comparative data then. But yeah, so if you and Holly could look at the other questions I shared, that would be super. I didn't have any questions on people and culture. It's not to say it's not a really important agenda, and I'm grateful to Pri for all she's doing, and I think we probably need to give that a longer amount of time to do it justice at another session, particularly around retention and recruitment of staff, I would suggest. On business and performance, I think we do need to be really brisk here. Stephen, there were some questions, and I think you were picking these up. Is there anything immediately you could come back with?
Thanks, Eileen. I'm just having a quick look at my notes. There's a question actually from Anthony around business and performance, around that he's put some questions in actually, Eileen, and we've not picked those up. So I think for in essence of time, if I go back to Anthony direct after the meeting, actually I'm conscious, Anthony, you won't be available, but I can pick up offline, Anthony, and we can just try and find out where those questions have gone.
All right. I think we went through a lot of Anthony's questions at yesterday's meeting. Keith.
Yes, thanks. There was one question on that report around the CYPF community paediatrics, It's on page 6 of the operational performance report. There's quite a concerning trend shown on the graph on that page, and it says that there's a risk to the trust of not meeting its statutory and contractual obligations, and a very significant deterioration in the waiting time situation since January. So we did discuss this on Tuesday, and it was really wanting to understand and to have some assurance around what is being done to support the team with what looks really quite dramatic from what's been presented.
Ollie, do you want to come in on that?
Yeah, very happy to, and thank you, Keith, for raising. So the community paediatrics service sitting within children and young people's is under what we call a block contract. So actually there are a number of activities that are included in the service specification that sits under community paediatrics. And it includes things like initial health assessments for looked after children, our sort of developmental disability, neurodisability and autistic spectrum condition management, general development assessments of children, some audio vestibular medicine, so hearing impairment and vision, working with local education authority around educational medicine and those children who sit within special educational needs. So there is a variety of sort of activities that sit under that one sort of service specification that's called community paediatrics. And we've seen an increase in referrals across a lot of those activities. We don't have, this is a resource issue in terms of we haven't had an increase in resource to manage the increase in referrals. And we've also been asked to really focus on our initial health assessments for looked after children, because that has a national mandated target associated with it. So children referred to us under that pathway should be seen and assessed within 20 days. And the ICB asked us to focus on our initial health assessments because we were sitting at roughly about 31 days for those children rather than the 20 days. But as a result of doing that, we've had to stop some of the activity with the other pathways that sit under community paediatrics. Hence, you will see that increasing waiting list and time for those children. In terms of what we're doing about it, so we're having conversations with ICB colleagues. It is part of our improvement plan that will sit under the improvement board. We've also agreed that we will have a discussion around our service specification and contracting arrangements at our assurance meeting. We have received some interim funding, particularly around those initial health assessments for looked after children, which has enabled us to bring in some additional resource to tackle that particular path of our community paediatric service. But obviously we have highlighted that because that is just for a specified period of time, the minute that funding stops, we will start to accrue waiting list in the initial health assessments, and our only way of currently meeting that mandated target is to divert resources away from those other pathways. We're also taking the opportunity a bit, similarly to the FCAMs of sort of reviewing those pathways to make sure that they're as sort of effective and efficient and as productive as they can. Venkat and Nicola, who are the sort of leadership team, along with Amanda for Children's and Young People, are meeting regularly with the paediatric community team. And obviously Venkat, whilst he's the clinical director of Children and Young People, he's also a consultant within that community paediatric team. So the team feel well supported in terms of they know that we're acknowledging the issues that they have, but we need to take forward those conversations with the ICB around the overall service specification, and we have had a commitment from the ICB that this will be one of the first pathways to be reviewed.
Okay, I think
Thank
it is
you.
worth saying, talking about the way that we are often funded, and this reference to block funding, we get a bucket of money, if you like, and that assumes that we'll see so much activity. That makes us different from acutes in as much as they tend to get paid for everything that they see. So every piece of activity will get paid for. We get a bucket of money that assumes, makes assumptions, and they're almost always under around what we will do. So the assessment of looked after children, I think Holly will correct me, we're funded to do 15 a month or something like that. But the run rate has been on occasions almost double that. So you will appreciate that trying to stretch a resource that pays to do something 15 times to do it 30 times doesn't always work desperately well. So there is just a flaw in the way that community physical health and community mental health are funded in this country. This sense of assumptions against ever-increasing demand is really just letting us all down, and particularly the people who we're trying to serve. So Anna, if everybody's okay, I'm going to suggest that we have guests this evening who are coming to talk to us about our wonderful Young People's Forum. So I'm going to hand over to Anna, and Maisha, I think, is with us again. So over to you, and we're looking forward to hearing from you.
Thanks, Eileen. I'm just going to pass straight on to Maisha and the young people who are here to join us.
So we're all incredibly welcome. So Maisha and your colleagues, lovely to have you with us. And Danielle and Alia, fabulous.
Thank you so much. And SA has just joined as well. We are waiting for Cavalia, but I've not heard from her this evening. So it might just be Cavalia for some reason isn't able to make it today. Hope she's okay. So without further ado, I do have a presentation which I'm going to be sharing, and there is a recording in that presentation because Laura, who wanted to be here, unfortunately couldn't make it, but she has prepared a recording for you. So I'm going to share my presentation. Hopefully it works. Let me try again because I want to do it with sound. So include sound and then present, and it's now disappeared. So apologies, everyone. Technical difficulties. It always happens.
It happens to us all, Maisha, so don't worry.
Brilliant. Right. So I'm going to share with the sound this time. Okay, so I'm hoping you can all see my screen. So yeah. Thank you so much, everybody, for inviting me and some members of the Young People's Forum to talk to you today about our CPFT Young People's Forum. We do have a bit of an agenda, just so you know what to expect. So in the meeting, you will hear from the forum members, find out who they are and what they each bring to the forum. Danielle will be giving you a bit of a snapshot of the forum, and then Cavalia, who isn't here, so I'll deliver Cavalia's slide, which is all about youth voice and why it is important in healthcare. And then SA will be coming in to give you an update on our work so far and the progress we have made. And then you'll be in Alia's lovely hands, and she will tell you about some of the challenges that we might face and our plan to overcome them. And then lastly, there is a video from Laura just giving you more insight on our goals, visions and aspirations for the future. And then at the end, I'll just summarise and close the meeting. So without further ado, I'm going to hand over to our incredible forum members, and I'm so honoured to be introducing you to them. So I will hand you over.
Good evening, everyone. My name is Essay. I'm currently 17 years old, and with my lived experience in mental health, I believe that I know sort of what young people might need for us to reach out to and how we can accurately support them, if that makes sense. So that's what I personally think I bring to the forum.
So Cavalia's not here, but she joined the forum because she actually helped a friend with her mental health, and she thinks that it's really given her some ideas on how mental health affects young people and how she can help them. So that's why she joined the forum.
Hi, I'm Danielle. I'm 15. I've also been a support friend in the past, but I also bring my past social research skills to the group, along with my communication skill set, but also the knowledge that this is a very important topic that connects myself to my peers. So being educated is important to make an impact. Thank you.
Hi, I'm Alia. I'm currently 15 and I aspire to make a change, even if it's the smallest one. I've unfortunately witnessed many people experience poor mental health, yet I have had the honour of being able to aid them through it, and I can only wish that I'd be able to do that for other people as well.
And we also have Laura, who's 15, and Laura has actually has personal experience working with mental health services, and she feels those real life insights allow her to highlight the reality for many young people. So I'm going to hand you now over to Danielle to give you a snapshot of the forum. Over to Danielle.
So the forum was first launched in October of 2023 with 6 members, and now we have a total of 31 members and are still growing. So the forum is a platform for young people aged 14 to 18 to shape CPFT services. It is a way to ensure the organisation is consulting and co-producing with young people and embedding their views across the different services. The forum is a space for young people to come together and discuss matters which are important to them. Forum members act as experts by experience, sharing their personal experiences, views and opinions on health and care services delivered within CPFT, but also externally in the wider care system. We have a broad diversity in our group with representation from the different communities across Cambridgeshire and Peterborough, including seldom heard groups such as BAME and LGBTQ+. We meet every 2 weeks online and have had a total of 9 meetings to date, with an average of 15 young people attending each time.
Thank you, Danielle. So that is a snapshot of our forum, and this is Cavalia's slide, but we thought it'd be nice to kind of highlight youth voice and why it is important in healthcare. So Cavalia said, no one can understand young people better than young people themselves. And Danielle says, young people are a large demographic of people and young people are the future, and health is a key part of life. And it dictates a lot of what young people can achieve. So young people should have an active role in decision making in healthcare, and young people are so innovative and forward thinking, and they really do know youth issues best. So here we've got a quote from Essay. So Essay believes it is important to listen to the youth in the mental health sector, as it is widely misunderstood by the leaders of the organisations that are responsible for offering mental health services. So there is a bit of a disconnect there. And Essay feels that listening to young people can provide new insights on how to accurately target and reach out to young people. And then Laura says that adult experiences are very different from young people's experiences. And it's important that the NHS hears directly from young people on what they want and need in their healthcare. And really, I guess the Young People's Forum is an opportunity for this sort of feedback, these views and opinions to be kind of shared with individuals like yourself. So this is youth voice and why it is important in healthcare. And I'll now hand you over to Essay, who's going to give you an update on our progress so far and the things that we've been up to.
Watching the forum.
Oh, Essay, I think you might be having problems with your mic.
Yeah. The campaign to ask us to be part of the clinical design groups for the and shape the service and ensure that young people's voices are embedded throughout. We've also supported the Wising Arts Centre with a bid for their Creative Health project. As a forum, we offered feedback and suggestions for the Wising Arts to use in their funding application. Also, we have ongoing with the Children's, Young People's and Families Directorate to create a young people's feedback survey, because at the moment there isn't really people to complete. As a forum, we will think of questions that are relevant to ask young people to obtain their feedback on our services. We will also be supporting the Directorate to implement their patient care race equality framework with a youth-focused lens.
Thank you, SA. I think SA, unfortunately, Mike kind of went out there at the start, but really, essentially, the forum has already started working on aspects of service development. So we're really working with different teams across the trust, and we're making great progress, and it's really exciting to see some of the upcoming projects as well. So thank you so much, SA. I'll now hand you over to Alia, who will talk through some of the challenges that we might face and how we plan to overcome them.
So I'm going to speak on the challenges that we're facing as a forum and how we can plan to overcome them with your support. So our biggest challenge is not being able to meet in person. All of our meetings have been online, and although we are trying to meet in person, it's really difficult to find spaces in the community that are free for us to use. Therefore, we will be working with CPFT's Head to Toe charity to fundraise for our forum so we can fund our work. The challenge for society is that there's a huge stigma surrounding mental health. As a forum, we would like to support young people to speak about mental health, to understand mental health better, and ensure that the right support is out there for young people to access. We plan to run workshops on raising awareness of mental health for young people so that they can feel comfortable in talking to us. Another challenge we face is promoting our work and the forum itself. We want young people and professionals to know who we are and what we do, so they can make the best of this use of the forum. We aim to attend community events and use social media to promote our forum, but we as young people ourselves can also tap into our existing networks to spread awareness amongst our peers. Thank you.
Brilliant. Thank you, Alia. And last but certainly not least, I'm going to play a video from Laura talking through our vision, aspirations and goals for the future. Now, I do hope this works, so just bear with me.
So, the potential of this forum is boundless. I believe this group can accomplish anything, and there is no limit to what we can achieve. We want to spread the word, collaborate with all our partners, and reach out to different organisations who are willing to work with us. We really want to engage with youth groups, to network with them, share information, and engage them with our work. There is so much incredible youth work happening, and if we collaborate, we can create a bigger impact. A big thing for us is, as a forum, we want to create and form stronger bonds in the group and continue building relationships with each other. The better we know each other, the more efficient our work will be. We hope to meet in person so we can really understand one another and utilise the skills we each bring to the forum. We hope to facilitate our very own launch event so the community know exactly who we are and what we hope to achieve. We will be having an away day in August to workshop, plan and organise our work for the year ahead. Thank you.
Thank you so much for listening. So that brings us to the end of our presentation, and we really welcome your questions and we appreciate any feedback because we are a new group. And if you would like to connect with CPFT's Young People's Forum, you can contact me. So my email is there on screen. It's maisha.carnham@cpft.nhs.uk. But I just want to say a huge congratulations and well done to Danielle, SA, Alia, Cavalia and Laura, because they gave up their Saturday to create this presentation, and we created this presentation especially for you from scratch on Saturday morning. So thank you so much to the forum members and for all their hard work, and thank you for listening.
Well, I think we should start by saying thank you, Maisha, for the wonderful leadership you are giving to the forum. It's outstanding. I'm very fortunate. It's the second time I've heard from our wonderful young people, and it's as impressive now as the first time I heard it. So thank you for your Saturdays, but thank you for all you're doing. I suppose I would say that we should be doing all and everything we can to support you in meeting in person. So it's not necessary that we should have to rely on charitable giving to make that happen. So I'm looking at Stephen to sort of take that away as a bit of an action to see what we might be able to do. Maisha, that does feel like something that we would benefit hugely from. We've got just a couple of minutes for any questions, so I'm going to open up to the floor. You saw how everybody loved hearing from you, but any questions for Maisha and her team? Mike.
Yes, Maisha. Hello, I'm Mike. I'm one of the non-executive directors. Very nice to meet you, and thank you to all of you for your presentation. Absolutely terrific. So two thoughts came to me when you were late. Can we come to you and ask you questions, and to get your input on stuff, or do you meet and tell us stuff? I mean, is it a two-way sort of communication? Because I think that would be really helpful. And then I did just wonder whether or not you might have something to say about the new children's hospital, which is bringing together mental health and physical health, and whether you've been asked to input there yet or not, and if not, maybe you could. So, but thank you is the main thing.
Oh, thank you, Mike. So in regards to your first question, absolutely, it is a two-way process. So we really welcome teams or professionals in the organisation to come to us with matters that the Youth Forum can then consult with you and give you ideas and feedback. So, you know, if you do want to get involved, please do get in touch. We have so many people kind of lined up waiting to meet with us, which is brilliant. In regards to your second question, the Children's Hospital, in the presentation, the young people actually said they want to connect with other youth groups. They realized actually networking, connection, collaboration is the way forward. And I have been networking and collaborating with the Children's Hospital team. So I've been working with Sarah, Allen and Madeline, and we actually have a workshop next week on Tuesday to really map out some of that collaboration and what it's going to look like. So we're networking with other youth groups as well. So we are all working together because it's so important that our young people connect. So I hope that answers your question, Mike.
It absolutely does. Terrific. Thanks very much.
Thank you.
Eileen, you're on mute.
Yeah, sorry. Stephen.
Thanks very much, Eileen. Maisha, look, thank you so much. It was a wonderful presentation. A bit like Eileen, I've seen this twice now, and it's as impactful now as if it was when we first saw it. So, and I'm conscious, you know, I will take away and talk with Scott around the funding issue. I think that's really, really important. But just thinking about the audience you've got here tonight, what's the most important thing you want us to take away from your presentation?
Oh, that's such a good question. So I'll answer, but Danielle, Alia, Essay, if you are still on the call, you're more than welcome to jump in as well. So for me, it is really to acknowledge what these young people are bringing to the table and embed their thoughts and views meaningfully. So I do not want this forum to be a tick box exercise. I really want the forum to be used in the right way, in a meaningful way, in an authentic way. And I want the young people to really feel that they're making a difference and they're not just here to tick a box. So that is the main thing for me. So if I could get the support of each and every one of you to help this forum to deliver meaningful activity and really embed it into the organisation and the wider care system as well. So we can look back as adults and think, you know what, these young people are really making a change. They are the future and they are leading the way forward. That is what I want for every single young person I work with. And I really hope that I will get your support in that. So Alia, Danielle and Essay, if you're still here, do you have anything you want to add to that? You can always come off mute. You can pop it in the chat for everyone as well. And if you don't have anything to add, oh, Danielle, go for it.
Hi. No, this isn't anything that really hadn't already been said, but also that this forum is a tool for all of us to use, for you to use. If, as you said, if you have any questions, queries, anything that you want young people's voice on, it'd be great to use. If you have any people that you think will be interested in speaking to, I think that's one of the main things, is that it's here not as just like a tick box activity, as Maisha already said, but just something active and fluid that's moving, if you get what I'm saying. Thank you.
Thank you, Danielle. Anyone else got anything? Alia, essay? If you do, you can pop it in the chat as well for everyone to read later on. Alia, yep, go for it.
I just wanted to further expand on their points. I think it's really important to raise awareness on our forum and not just have it there as just kind of a do-gooder thing, because I think young people's voices are really important and can impact us positively as a society. I think young people are the future, so we need to prioritize them now in order to create a solid society and community for the future. Thank you.
That's absolutely brilliant. Thank you so much, Alia. And you could quite responsibly say that some of us of a certain vintage on this call have gifted your generation not the best sort of world. So we are reliant on you to sort things out for us. And I'm very encouraged by the levels of commitment that you're showing. It is brilliant. So thank you for that. And Maisha, I should say a very special thank you to you. I know you work very closely with Anna, who is equally passionate about this area. It's a delight to hear from you. We will see what more we can do to support you with meeting in person. That seems to be an entirely legitimate ambition to have. And we'll look forward to hearing from you again in the future about the progress you've been able to make, because you are helping us to improve. So thank you so much. Anna, thank you as well for attending.
Thank you, and thank you everybody, and thank you to the young people. Can't do it without them. They're the heroes here. So thank you so much. Brilliant. Yeah. Enjoy the rest of your evening, everybody. Thank you so much. Bye bye.
Brilliant. Thank you.
Thank you.
There we go. Jackie, you had your hand up.
I did, but I put it in the chat, Eileen.
Oh, bless you. Okay, thank you so much.
Okay, I'll pick up with Mahisha outside.
Right, wonderful, thank you. So I'm not sure how to follow that, but I'll follow it very quickly by talking about our chief executive appointment. So I've tried to keep people appraised via weekly notes, via Andrea being updated on Friday morning conversations about where we are at with our chief executive appointment. We are optimistic. I was going to say cautiously optimistic, but we're optimistic. I'm looking at Stephen, that we're going to be able to go through the process of selection in July. So there was a question about September, but we're hoping for July now. And let me just sort of outline to you where we're at. We're at a process whereby Odgers have been, I think, working well on our behalf to bring forward a range of candidates. And we've got 7 applications in, which is probably about 5 more than many trusts are getting at the moment. So that's really encouraging. I think there is an 8th on its way. I have spoken to all bar one of the candidates, and the possible 8th application is somebody I'm speaking to on Tuesday, who is a late applicant. But actually an interesting cohort of people, with all of them, without exception, having a background in community physical health and or mental health, which was the red line you'll recall that we drew on experience. Stephen and I are designing a process, which I've pre-warned all candidates about, which is a process of us wanting them to meet as much of the organisation as possible and some of our stakeholders, but also us through a range of lenses having the opportunity to get to know them. And if I marry that with one of the things that happened last week whilst I was away, I wrote out to all staff and invited staff thoughts on what they wanted from our next CEO. And I've spent quite a goodly proportion of this week responding to the vast numbers of staff who've taken the time to write to me. And my judgment is that if anybody takes time to write to me, I will always respond to them with really thoughtful and insightful views as to what our staff feel so strongly they want from a CEO. And they keep coming in. So they've been popping in whilst we've been in the meeting this evening. We're in parallel with that, having a number of forums that are being facilitated by NEDs for staff, so places that people can come together and have a discussion about what they want from our next chief exec. So we're trying to make this as engaging a process as possible. And what we want to do, of course, is to seek your views on what you'd like to see from our next chief exec. If I just give you a very sort of truncated view of what staff are saying, they want someone who actually knows the sectors we work in. That comes through really consistently. They want somebody who exhibits values that they recognise as being around creating an environment which is positive, underscored by kindness, bringing with them a proven ability to drive forward improvement and change. They want someone who takes a view as to how to create a team at many levels, but wants a strong leadership team and a strong approach to actually getting things done. So this ability to follow through, and also is able to help us to get better traction with our partners and our ICB on making sure that we are properly shaped and funded to serve our population. So I think that gives you a distillation of what are often very long and thoughtful notes that people have taken a lot of trouble over. And I have literally lost track of how many I've had, but it's now into the hundreds. So that's super encouraging that our staff are taking such an interest. But what I wanted to do was to open up to you as governor colleagues to take from you some thoughts about what you'd like to see in a CEO. So you can raise those things tonight, or you can write to me directly as well if something occurs to you afterwards. But also perhaps worth inviting Stephen for you just to talk about some of there was a question about people not recognising stroke remembering how governors have been involved in past CEO recruitments and what we're proposing to do this time in terms of the mechanics. So if you're able to, Stephen, because this is a sort of a decathlon event that we're designing, I'm just going to look to you in the first instance while people are gathering their thoughts about CEO characteristics, traits.
Lovely. Thanks very much, Eileen. So really briefly, we'll get the final long listing pack next Tuesday. We'll be shortlisting next week. Then we'll be opening up those candidates who've been shortlisted to service visits. There'll be relatively formal service visits. We've got to balance the service visits between not having too many people going around, but also recognizing that these people are really keen and they want the opportunity to come in, spend a bit of time in the organisation. There'll be a formal pack for them as well when they come on the service visits. There'll be some psychometric testing, and that's what we've done the previous 2 times as well. And then there's going to be a number of panels here. So there's going to be an exec, a NED, and potentially a governor panel as well, where we can come together for about half an hour, 45 minutes to meet each candidate. That's going to be a very open conversation, and again that will be a week beginning the 15th of July. There is also, though, and as Eileen's alluded to, we went out last week and asked people what you wanted from the chief exec, what type of quality, what type of sort of issues. We've also got 5 sessions where we're engaging staff, as Eileen said, facilitated by myself and the NEDs. And already we've had a lot of that went out on Tuesday. We've had a lot of people step forward and saying they're quite keen to be involved. And what we're also going to do is pull a selection of people from that group, and then we're actually going to ask them to actually meet the candidates. There'll probably be around about 25 to 30 people, and we'll give the candidates a bit of a sort of an ask to do, recognising that's a large group of people. And it will only be for about 30 minutes. And again, Eileen and I are just talking about how do we want to do that. And then obviously there's then on the day itself, there'll be a stakeholder panel that governors will be involved with, and they were involved with previously. And there'll be both an internal and an external stakeholder panel, and then there'll be a formal interview as well. And hopefully at the end of that, we'll be able to sort of appoint a chief exec. And after that, then clearly we then need to come to the Council of Governors and seek ratification of that process as well.
Okay. And just to say that all the candidates I've spoken to, I have stressed to them how that it may feel like there's quite a lot of engagement, but that's with a purpose. We want to get this right, and it's really important that everybody, including the candidates, feel that they've got a feel for CPFT and us for them. And they've all said at the moment that absolutely they understand that and are primed to participate, you know, in the very best way that they can. So that is good. So this really is an opportunity, if colleagues want to take it, if there's anything that springs to mind that to you feels absolutely essential, you'd love to see in a new CEO, this is one of many opportunities we've had, or that we will have going forward to think about this. But as we get ready for shortlisting, it seemed like the right thing to do to ask you for your views. Anybody brave enough to jump in? Keith.
Thanks, Eileen. Yes, well, reflecting on past appointments, I think it's really important that my governor colleagues who are continuing and will be arriving in post, we need a CEO whose instinct is to engage and involve governors appropriately. So, for example, governors don't have a right to observe at subgroup meetings, but good practice is that they do, and good practice is that they are involved appropriately in those meetings, rather than finding themselves in the position of being seen and not heard. So governors, you really need to be curious. Get the candidates to describe how they work with governors, how they've worked with governors, how they've worked with governors successfully, and really get a feel for what that relationship is going to be like. And I do think it needs probing, because actually I think it will be quite an indicator of their approach to involving others in addressing the undeniably huge challenges everyone has got to face.
Thank you, Keith. Really helpful. Anybody else moved to? Ian.
Yeah, I'd just like to second what Keith has said, because in the past we've had, well, I'm going way back, maybe 10, 12 years ago, there was a certain defensiveness on the executive team when governors raised questions, and they didn't want to face up to bad news, basically. So I think that's the sort of thing we need to be looking for, someone who is not going to be, as it were, we want to someone who's working with us rather than against us, and vice versa. We've got to work with them and not against them.
Yeah, absolutely. Anybody else? As I say, that this is, if you have thoughts afterwards, I'm very happy to take input. Chandra.
Hi, yes. Whilst the whole service side of things is being discussed, I would also like to find out if the CEO has any, or future CEO, who has had any experience in dealing with ESG, like environment, social and governance framework side of things, because that's an important emerging area alongside risk and various other things. And it's important that that person has basic understanding of what this means and how that could be integrated in governance.
Okay, thank you. All righty. Well, look, I hope you've got a flavour at least of the fact we're trying to be really thoughtful about this. We are making a virtue out of asking people what they want, and not just doing that to pay lip service. it is fascinating when you ask a question how much consistency comes back and how that consistency maps and marries with where the NEDs and the execs are. And we're going to have a parallel conversation ourselves on this next week as we move towards shortlisting. We will keep you posted. You will be involved in various ways. I mean, I would say, without being dramatic, that this is not an appointment we can get wrong. So I will always deploy we will never settle. If we're not happy with what we see, we won't settle. We will keep going until we find the right person. Now, I'm encouraged by the conversations I've had with candidates. That's great. But if we have any doubts, the thing we won't do is to settle. And Scott has given me his absolute assurances that for as long as we need him, he will be with us. And that is incredibly decent of him. So we hope for the best in July, but we're not going to be rushed into making a poor decision if the field in front of us isn't right for what we need. So just to be absolutely clear about that. Is there anything I've missed on recruitment, Stephen?
No, I think you've covered it. I mean, what I would say is anybody's got any questions, they want clarification on anything, please do reach out to me, and I can behind the scenes talk people through it. I'm very happy to meet with individuals as well. Brilliant,
thank you. And I should say, Stephen, he's been quite poorly this week, but he's continuing to push on getting this right as well. So I'm grateful in many ways to so many people, but when you're feeling awful, it's quite hard to keep going on some days. Anything else at all that people want to raise on what you've heard this evening that we've not had a chance to turn our attention to? Chandra, thank you very much for joining us. Caroline, is there anything we need to note under our terms of reference or cycle of business?
No, so they're both put forward to the council for formal approval for the coming financial year. No material changes to note on either, Eileen.
Okay, thank you so much. Ian, did you want to come back in?
Yeah, in terms of reference, there's a paragraph which I've got in front of me saying that governors are expected to attend as many council meetings as possible. A governor may cease to hold office if they fail to attend 3 consecutive meetings. In last year's annual report, there were 4 governors who attended no meetings at all. So I wonder, did anything happen? If not, why not? And in future, can I ask that something does happen if that occurs again?
I think that's quite reasonable, Ian. Let's just keep a look at our logbook of who's attending with perhaps a slightly harder-nosed eye than we've deployed in the past. Let's leave it at that. Right. Caroline, do you just want to speak briefly about the our AGM and annual members meeting in September?
Yes, of course. So just sorry, Eileen, just on the previous point, just to say that will be easier to manage as well with a bigger council and the seats filled. I think we've been quite thin on the ground with our governing body, haven't we, in some areas, some constituencies. So I think, we'll keep closer and tighter look on and grip on that through the committee process. So with regards to our annual members meeting, it's come around very fast. So the date for that is the 12th of September. It did come up at Tuesday's COG pre-meet, so thank you for the feedback through Andrea that you've all provided on that. We are looking to hold an exclusively in-person event this year, hopefully in Huntingdon. Last year, you might recall that we held the event at the Resource Centre in Cambridge to celebrate the opening of the Resource Centre. We did agree at that time that we tried to rotate around the county throughout year on year. So this year we're trying for Huntingdon. Next year we'll aim for Peterborough, so we get a full house. We have some ideas that we're just thrashing around and trying to firm up the agenda as in line with the feedback from Tuesday's pre-meet, which I'm just in the process of summarising and reaching out to people to try and firm up some arrangements. So I'll come back to confirm as soon as possible on those once I've got a bit more of a definitive response from people. But we have a good direction of travel. We have some good ideas. The feedback's been really, really helpful, and it's really good that we've captured that quite early on this year, to get, you know, a good consensus of what the governors would like at the annual members meeting, which I think is really, really important and something that's been missed previously.
Brilliant. Thank you, Caroline. Really helpful. So I neglected to ask at the outset if anybody had any AOB, so I'm asking now. None was notified to me in advance. All right. I don't know what's happened in the football. I'm sure some of you have been keeping an eye on it. No, it's not my thing. Diana, you look almost poised to come in. Helen.
Oh, 1-1, and we were rubbish.
Okay. All right. On the basis it matters not a jot to me.
How can you say that, Eileen?
I know, I'm a terrible person, Diana, just a terrible person. What can I say? What can I say? I'm just glad it was early and it hasn't got disturbed me from actually watching some television this evening, because I have to leave the room when it's on. All right. Can I say an enormous thank you to everybody for all the time and thought you've given to being with us this evening, and indeed for all that you do outside of this set piece meeting. We'll look forward to catching up again, and I'll see various of you in other